I'm here to announce that there are 24 new Tulsa County cases, bringing our total of COVID-19 positive cases to 175. I am pleased to report that we now have 20 people who we've officially called recovered from COVID-19. And it's important to understand that most people who become infected will experience mild symptoms and they will recover. Some individuals, primarily those at-risk groups we've talked about in the past, are older demographics, those with immune compromised conditions or underlying health conditions, will probably require hospitalization because their illness will be more serious. And I say that because unfortunately we are reporting 3 additional people who have died from complications of COVID-19 in Tulsa County, bringing our total of deaths to 8.
We get a lot of questions and have received a lot of questions over the last week about, can I do this or can I do that? I would say to that 2 things. One, you can go to the cityoftulsa.org website, and right at the top you'll see a box that pops up that says COVID-19. You click on that and it takes you to the real focal point for information on this event as it relates to the city of Tulsa. On that page, there's a frequently asked questions link that you can click on. I go to it routinely throughout the day when people are asking me questions to look up things. Anybody can use it. And it has a lot of the questions that you might be asking or that might be coming to mind. You can just go there and get that guidance immediately. The other thing that I would say, though, is under this order, in being mindful of how much people in our community who are taking this seriously are sacrificing to slow the spread of this virus, is that if you have to ask, the answer is probably that you shouldn't be doing it. It's really pretty simple as far as the things that people should be out of their homes to do. Getting food, taking care of their health, going to a job at an essential workplace as defined by the state of Oklahoma, and that's about it. If it's not one of those 3 things, then you should be at home. And not just for you. If you don't care about your own personal health, that's your business. But this is about preventing people from spreading this unknowingly to other people in our community. So far, the science around this shows that somebody can have this between 5 and 13 days before they even have symptoms. You think about all the people you care about. Would you want to be the person that is unknowingly making them ill and giving them this potentially deadly virus? I would hope not. And so if you don't want to be that person, then practice social distancing and follow the shelter-in-place order that has been put out there. But also say that for the folks that aren't following this, you're putting our first responders in danger. And at this point in the city of Tulsa, we have about 3,700 employees that work at the city. We have 57 different employees in quarantine right now, and 1 employee who's tested positive for COVID-19. I'm very grateful for the quick action of the Tulsa Health Department in letting us know anytime there's a positive case. They do a really good job at looking to see if there's been any exposure to one of our first responders so that our first responders can identify that particular situation and then trace back anyone that might have had contact, and they can be quarantined immediately for observation. And I also want our police officer who contracted this virus, if he sees this, I hope he knows that everybody on our team at the city is thinking about you and praying for you.